If you ever wondered why twisting your trunk is a little bit easier than bending backward the thoracic region, well, that is not accidental at all. And by the way, the thoracic spine is built for protection and not flexibility, but it has one movement that it does exceptional well, and that is rotational movement, the twisting movement. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny, and in this video we're going to discuss the unique design of the thoracic spine. Consider subscribing if you want anatomy that actually makes clinical sense. Alright folks, let's see how it turns out. Thoracic spine is that region of the vertebral column that falls under the thoracic region. This is what we call thoracic spine, and the thoracic spine is kyphotic in nature, meaning it is concave anteriorly. It is made of individual bones which are called the thoracic vertebra. So we have 12 thoracic vertebra. They are denoted by letter T's. So we have T1 through T12, and this region is what forms the thoracic spine. The thoracic spine is made up of individual thoracic vertebra, which are 12 in number. But the size of the thoracic vertebra, they are increasing as you're moving down the spine. Why? Because you said the ability of weight bearing increases as you're moving down the vertebral column, and because of this also the thoracic vertebra, they are a little bit bigger and stronger than the cervical one, but they are weak. They're a little bit weaker and smaller compared to the lumbar one, because lumbar bears significant amount of weight. Another important thing about the thoracic vertebra is that the transverse processes are strong and larger, because they are going to articulate with the ribs. You're going to see how they form joints with the ribs. So what is so important thing about the thoracic vertebra is the articulation with the ribs, the ability to form joints with the ribs. So they should have something that will enable them. They should have surfaces that will enable them to articulate with the ribs. What are these surfaces? We call them the costal facet. So this is an example of costal facet here and here. But before we talk anything about the costal facet, let's first see the difference between a facet and a demifacet, because you'll be wondering why do we sometimes call a demi and sometimes call a facet. One full articulating surface is known as a facet. One full articulating surface is known as a facet. But at some point we see how a half facet, a half is this articulating surface, and this we call the demifacet. A demifacet is a half articulating facet, But someone is asking himself, someone is wondering, what is this? Why should you have a demifacet to begin with? We have a demifacet. We're going to see later, that I'm going to emphasize later, that we see one rib we actually articulate with the two adjacent vertebrae in such a way that we have a one full facet, but this one full facet is actually being contributed by the adjacent vertebra. So the vertebra above are contributing half a surface, and the vertebra below contribute a half a facet. So in total we have a one full facet, but in fact this facet is a combination of two demifacets. So we have the superior, we have an inferior demifacet from this vertebra and the superior demifacet from this vertebra, that they combine to form a one full facet. You see, so the ribs are just complicating your lives, because they would choose to articulate with one vertebra, but they are choosing the center between the two adjacent vertebra just to make your life a little bit miserable. Okay, so this is the difference between facet and demifacet. One full articulating surface will be a facet, but a half of articulating surface will be a demifacet. And we've already seen why should we have a demifacet? Why should we have a demifacet? Okay, now let's discuss the typical features, the features of the typical vertebral thoracic vertebra. We have already seen in the previous discussion, the discussion of the vertebral column, that a normal vertebra should have a vertebral body, vertebral body, vertebral arch, and the 7 processes, which later we see that we have a vertebral foramen that we already discussed the other time. But how do these vertebral bodies, the vertebral foramen, and all these processes behave in a typical thoracic vertebra? How do these features behave in a typical thoracic vertebra? To begin with the vertebral body. The vertebral body of a typical thoracic vertebra, number one, is expected to have a heart shape, a heart shape, this one, a copper shape, the thoracic body, the vertebral body of the thoracic vertebra is expected to be a heart shaped, but it is also expected to, the body is also expected to have the 4 costal facets. So we have 2 on this side and 2 on the other side. The body is expected to be a heart shaped, but also it is expected to have 4 articulating costal facet, 2 on this side and 2 on the other side. What about the vertebral foramen? The vertebral foramen of the typical thoracic vertebra is expected to be circular and smaller as compared to the cervical and the lumbar one. So how small is it? Is small so that it's small to the extent that it only admits the tip of your index finger. It only admits the tip of the tip of index finger. But why is it smaller than the cervical and the lumbar one? Because we said, I told you the other time, we haven't discussed about the spinal cord yet, but I told you the other time that you have the spinal enlargement, the enlargement of the spinal cord at the cervical region and the lumbar region. So for this reason, we have an enlargement also of the vertebral foramen at the cervical region, the lumbar region, but at the thoracic is actually smaller because the spinal cord is smaller at that region. We're going to see why. We're going to see when discuss the spinal cord why is the cervical and the lumbar region of the spinal cord larger than the rest of the vertebral foramen. And what about the transverse processes? So these are the transverse processes, and the transverse processes of the typical thoracic vertebra, they are expected to be long and strong, and they are pointing posterolaterally. Why long and strong? Because we've said they will also articulate with the ribs. So they will form joint with the ribs, so they have to be strong compared to the cervical and the lumbar one. Because the cervical number one, they do not articulate with the ribs, so they do not need the stability for ribs and all that. These are the transverse processes. They are significantly longer and long and strong, and they are extending posterolaterally, but the length, among the thoracic vertebra, the length of the vertebral of the transverse processes keeps on decreasing from T1 to T12, and we see that we emphasize this point later that the transverse processes of T11 and T12, they do not have the articulating surfaces for articulation with the ribs. Let's talk about the articular processes. We said we have 2 articular processes on either side, on the vertebral arch. Superior articular processes, so we have the 2 superior articular facets or articular processes and the inferior articular processes. How do the superior articular processes behave on the typical thoracic vertebra? They are pointing posteriorly but a little bit laterally, so they are pointing posterolaterally. See, they are pointing posteriorly but a little bit to the lateral side, But what about the inferior ones? The inferior, they are pointing medially but a little bit anteriorly, so they are pointing anteriorly but on the medial direction. We see, so they are forming that joint that we said is a zygapophyseal joint, or it's also called the facet joint. But this joint, we see how it enables the rotation of the thoracic spine, but it limits flexion and extension of the thoracic spine. Lastly, talk about the spinous process. So this is the spinous process. The spinous process of a typical thoracic vertebra, it is expected to be longer, and very longer than the cervical and the lumbar one. You see, this is the cervical. These are the cervical vertebra. So the spinous process are a little bit longer, shorter compared to the spinous process of the typical thoracic vertebra. So what are the typical characteristics of the spinous process of the thoracic vertebra? Is expected to be long, but it is sloping posterior posterior inferior, pointing downward in such a way that the tip of the spinous process of the cervical of the thoracic vertebra is actually found at the level of the thoracic vertebra below it. For example, this is T4. The tip of the spinous process of T4 is actually found at the level of T5 vertebra. So they are very long and they are pointing downward. And we see later this also limits the movement. This also limits the movement. But you see, these are at the back of your, the median furrow. You have a median furrow at your back. So you can always feel this transverse. These are the spinous processes. The very first one, this is the spinous process of C7. And C7, the cervical, the 7th cervical vertebra is actually long and is very prominent, and is called the vertebral prominence. When we're discussing the cervical vertebra, we talk again about this. It's projected on the root of your neck, downside. But the rest of them, these are the spinous processes of the thoracic vertebra, and we have said they are pointing posterior, inferior. But I will later emphasize that the spinous processes of T11 and T12, they do not follow this general rule, because they are very short and almost directing posterior, and their tips are almost found on the same level. For example, T12, T11, the spinous process is found almost on the same level, and also for the T12, the spinous process is found almost on the same level. Let's go back to discuss the articular facets, the articular surfaces of the thoracic vertebra. Remember, what is so important of the thoracic vertebra, we've said, is articulation with the ribs. So a normal typical thoracic vertebra is expected to have the 6 costal facets, 6 articulating surfaces to form joints with the ribs. So 4 of them, they are found on the body, as we have seen, and 2 of them, the rest are found on the either transverse processes. So the body is expected to have 4 half facets, 4 demifacets. 2 are superior and 2 are inferior. So on the other side, you have superior costal facet on this side, right, one on the right, one on the left, 2 of them. And then also we expect to have the 2 inferior costal demifacet, or inferior costal facets, or inferior demifacet, one on the left side and one on the right side, and then that makes a total of 4. And then we'll have 1 transverse costal facet on either transverse process, making 4 of them. But how do they actually articulate with the ribs? A rib, as I've told you, a rib is expected to form joints with the 2 adjacent vertebrae. So the head of the rib also has 2 articulating facets. That's the superior articular facet and the inferior articular facet. Let me pull this picture here and show you what happens here. So for example, this is superior costal facet of T5. This is the inferior costal facet of T5. This is superior costal facet of T6, and this is inferior costal facet of T6. What happens is a rib, as I've told you, is expected to articulate with the 2 adjacent thoracic vertebra. It chooses to articulate with the 2 adjacent thoracic vertebra in such a way that the superior articular facet of a rib will actually articulate with the inferior costal facet of the vertebral body above, and the inferior costal articular facet of a rib is actually articulating with the superior costal facet of numerically same vertebral body. Do you understand here? Like if this is rib number 6, for example, if this is rib number 6, the inferior articular facet of rib number 6 will articulate the superior costal facet of numerically same thoracic vertebra. So 6 for 6. But the superior articular facet of rib number 6 will articulate with the inferior costal facet of the vertebral body above, which is 5. So you articulate with the T5. This is what I was emphasizing here. But the transverse processes will also have a transverse costal facet. This transverse costal facet, we will see later that it articulates with the tubercle. We have a surface at the tubercle here, but they are numerically the same. So the transverse process of T6 will articulate with rib 6. There is no confusion in the transverse process. But the difference is on the vertebral bodies and the head of the ribs, superior for inferior, and superior of vertebra we articulate with the same, inferior of the same rib, but inferior of the rib we articulate in the superior of the same, of numerically the same thoracic, numerically the same thoracic vertebra. Okay, so this is not happening to some vertebra. The general rule is that each vertebra is each rib is expected to articulate with the two vertebra, but this is not happening to some vertebra. For example, T1, T10, T11, T12, and so they are fall under a typical group because they do not follow the general rule. The general rule is articulating with the two. The general rule for the thoracic vertebra is that each thoracic vertebra is expected to have two demifacets, one superior demifacet and one inferior demifacet on either side. But we see, for example, the thoracic vertebra number 1, T1, it has one full articular facet and a half. So instead of having half and a half, it has 1.5. So it disobeys the rule at all. But it's very understandable because it has one full facet, one superior full facet, because it didn't have to have a half a facet here, because we do not expect any half a facet from the cervical vertebra, because the cervical vertebra, they do not articulate with the rib, so they do not at all contribute to the cervical to the demifacets. And so the T1 is actually expecting, okay, you are not contributing any form of full articular facet, and so it has one full facet and a half. So it is atypical, but it's very understandable because the rib 1 will articulate with only one thoracic vertebra, with only one vertebra, and that will be T1. We do not expect the rib 1 to articulate with the C7. This is why you have a one full facet from T1. One full facet is completely understandable. It's very atypical, but completely understandable because it won't articulate with one rib, which does not want to go to the cervical vertebra, to the cervical vertebra. So it won't articulate with the rib 1. But what happens to okay, and then it has inferior demifacet, which will be completed by the superior demifacet of the T2 to form one full articular surfaces to articulate with the second rib, with rib 2. What are the other T10, 11, and 12? So they all disobey the rule, because what is the rule? The rule we have said the rule is to have two demifacets on either side. But these T10, 11, and 12, they have one full facet, not half and a half. So example, see, you have one full facet, one full facet, one full facet. So this is very unusual. We do not expect them to behave this way, because meaning that they will articulate with only one rib, because the rib will not go at the junction between the two vertebrae, because we do not have articular facets at the two adjacent vertebrae. We have the articular facet at the center of the body, T12, T10 is very diverse. It can have one full articular facet, or sometimes it only have just a half a facet on the superior, and it lacks one on the inferior surface. So so sometimes the T10, it has a half a facet, it has a demifacet which is superiorly placed, which means that the rib number 10 will articulate with both T10 and T9 as expected. But sometimes the T10 just got one full articular surface in such a way that T9 doesn't have any inferior costal demifacet. So sometimes the superior, sometimes T10 makes T9 atypical. Because you see here, T9 is already atypical. It's already atypical because it doesn't have inferior demifacet. It was expected to have the inferior demifacet, but for this reason, the T10 has already articulated with the full, which has contributed full facet to articulate with the rib 10. So T9 has got any contribution for this case, and for this case, T9 also becomes becomes atypical. So what are the typical thoracic vertebra? The typical thoracic vertebra, we expect them to be T2 through T9, and T1, T10, T11, T12, they were expected to be atypical. But the most typical, they, to T2 to T9, they are typical. They are typical. But the most typical ones is T5 to T8. So T5 to T8, they are expected to have everything that you expect from the thoracic region. Okay, T5 to T8, they're expected to have everything. But if you ask in the exam what are the typical thoracic vertebra, you of course mention T2 to T9. These are very typical. But the most typical ones is T5 to T8, because you see, for example, here T9 sometimes it lacks the inferior costal facet, the inferior demifacet, and so it becomes atypical for some circumstances. And it's actually made atypical by the T10, because T10 chooses to have to take the whole articular facet. But we see later that so this is general for T10, 11, and 12. But we see also the T11 and T12, they do not have the transverse processes. So we see that they do not have the transverse costal facets. They lack transverse costal facet. You can see the transverse costal facet on T10, but T11 and T12 they do not have. But what did we say about the transverse process? The spinous processes a few minutes ago, that the transverse processes are very short. They are very short, and they are pointing posteriorly. They are pointing almost transverse, in a transverse direction, but they are pointing posteriorly, almost horizontal. But their tips are also found on the same level. So T11, or you see the tip of the spinous process of T11 is almost found on the same level. The tip of the spinous T10, T12 is also found on the same level. But T12 is very unique, that we have to discuss the T12. As we have said, the T12 is expected to have only one facet, which is at the center, and so it articulates with only one rib, which is rib 12. But also we have said it doesn't have the transverse costal facet. It's okay. But T12, one among the very important thing about T12 is that it acts as a unique transition from a rigid spine, where we are moving from the thoracic spine to the lumbar spine, and this transition is almost happening at one level, at one vertebra. I want to show what are the transition. So we see we're coming from the rigid thoracic spine. As I've told you, it only allows rotation, but we are moving into a very mobile part of the spine, which is lumbar, with a lot of movement. So it has the superior. So it acts as a very unique bone, a unique vertebra, because it behaves both as the thoracic vertebra and both as a lumbar. So both are the thoracic and lumbar vertebra. The superior half of the T12 is expected to have features of the thoracic vertebra, typical features, not the typical features, but features of the thoracic vertebra. But the inferior half of T12 is expected to have the features of the lumbar vertebra. So it is thoracic in that it has a costal facet here for articulation of the rib, which is the rib number 12, but it also the superior articular surfaces, they are directed in the same way as the superior articular facet of the thoracic vertebra. We have mentioned earlier today that the superior articular facet of the superior articular facets or articular processes of the thoracic vertebra, they are pointing posteriorly, but a little bit on the lateral side. So they're pointing posteriorly, as you can see, but a little bit on the lateral side. For this reason, the superior articular processes of the thoracic vertebra, they allow rotation, this kind of rotation, but they allow rotation, but the flexion and extension is limited by some other factors. But I want you to appreciate that the T12, the superior articular processes of T12, the superior articular facets of the T12, they are behaving almost in the same way as the superior articular processes of other thoracic vertebra. But what did we say about the inferior articular processes, or facets? We said a normal thoracic vertebra is expected to have inferior articular processes or inferior articular facets that are pointing inferiorly but on the medial side, so anterior medial. So they are pointing anterior medial. It's expected to have it is expected to have the inferior costal facet, the inferior articular facet that are pointing anteriorly but medially. For example, T11, this is T11, the inferior articular facets of T11, they are pointing anterior medial, and so they are articulating with the superior articular process of T12 in this fashion. So for this reason, they are allowing movement in, rotational movement in this direction. I will later tell you why other movements are limited. But I want you to appreciate that the inferior articular processes, the inferior articular facets of T12, they are not pointing medial, they are not pointing anteromedial, they are pointing laterally. This is very strange. This is very, very strange because instead of pointing anterior medial, they are pointing laterally. They are pointing laterally. So this is T12 here. You see the inferior articular processes, they are pointing laterally instead of pointing medial. So that is a remarkable change because we expected all the thoracic vertebra to have the inferior articulating processes that facets are pointing medial, but this one is pointing laterally, and it poses significant changes on the thoracic spine. So this one limits rotation. So you see how it articulates here. This bone cannot rotate in horizontal and cannot twist in this way. So we are moving from a region of the spine that was allowing rotation and significant rotation, but we are coming to the lumbar region, in which the rotation is very remarkably limited. So this means so the inferior surface, the inferior half of T12, number one, it has got no costal facet because we didn't have half a facet, but it has the inferior articular surfaces that they do not allow rotation. This is very important clinically. The superior half allows rotational movement. The inferior half does not allow rotational movement. Why is this so? Because of the orientation of the articulating processes. The superior, they are perfect. The inferior, they behave like the lumbar one. They behave like the lumbar processes, and this actually poses a significant threat into the stability of the spine. All right, guys. It has also got the mammilla bodies, mammilla processes. These are the mammilla processes for attachment of some other muscles, which were not present. We didn't have mammilla processes in this side, but you can see in the lib 12 we have the mammilla processes for attachment of some muscles. As I've told you, most of transition from a rigid thoracic spine in terms of extension and flexion and extension into the more mobile lumbar spine, which allows flexion and extension. These features are happening in a single bone, that is T11. So this makes this region from T12, L1 and L2, T12, L1 and L2 to be the most vulnerable in case of vertebral compression fracture. Most of the vertebral compression fracture, they will happen at this region, T12, L1 and L2. Why T12? At least you know that will have a remarkable change from the rigid thoracic spine into the more mobile lumbar spine. The change is happening within a single bone. So T12 used to be the most fractured bone, but recent literatures, they suggest that L1 to be the most fractured bone, the most fractured vertebra of all the vertebral column, of the vertebral bones of the vertebral column. L1 is the most fractured one, followed by T12. At least you know why T12 is most fractured. It experiences a lot of stress because of how it behaves. It's a transition zone from a rigid spine to more mobile spine, and then the superior surface, the superior half allows rotation, the inferior half limits rotation, and so this makes it very vulnerable in case of fracture. So the vertebral compression fracture happens mostly at that region. You'll be asking you exams at some point. What are the movements of the thoracic spine? Now I want to show you what I was emphasizing. I told you earlier in this discussion that the thoracic spine is meant for stability and not flexibility. So it's meant for stability, means stability and protection, and not flexibility means does not allow very much movement. Of course, there's one movement that does exceptional well, as I've told you, and that's rotational movement, but the rest of the movement are limited. So it's like sacrificing its mobility for stability. Like I want to be more stable than mobile. I want to be more stable than mobile. So what are the movements of the spine that we learned the other time? We said we have flexion, extension, lateral flexion and rotation. So what is the flexion of the thoracic? How about the flexion of the thoracic spine? So the thoracic spine has got some flexion, but it's limited. Why is it limited? Because of attachment of rib. So the rib attachment, they limit flexion, they limit flexion of the thoracic spine. What about the extension? Extension is there, but significantly limited, like profoundly limited. Why is it limited and how is it limited? It is limited because of two important factors. Number one is the long spinous process. So in such a way that when you want to extend back, the spinous process, they get stuck on one another, and so the extension is limited to that extent. Okay, but also have anterior longitudinal ligament that when you extend your thorax, it becomes taut, and so it also limits. So the two important things that will limit extension of the thoracic spine is the long and down projected transverse spinous process that will limit extension. What about lateral flexion? The lateral flexion will be there, but limited. Why is it limited? Because we have ribs attached on the lateral side. So the flexion is there, but limited. But what is so limited, what is profoundly limited is extension, and we have already mentioned the reasons. What about the rotation? I've told you this is the best movement, the movement that is best allowed by the thoracic spine. So in general, the thoracic spine is almost rigid, but it only allows one movement, and that is rotational movement. Why rotational movement? I've told you because of arrangement of the articulating facets. You see, we have the superior articular facet that are lying in this plane, or a little bit, little bit posterior lateral, but the inferior articular facet, they are lying a little bit anterior and inferior anterior medial. You see, so they are forming this joint. This joint is actually a plane joint, and I told you the plane joint, they allow movement in almost all direction. But the movements are limited by some other factors. For example, we've seen the flexion is limited by ribs, the extension is limited by the spinous processes, but there's nothing like actually there to limit the rotational movement, to limit the movement to the gliding movement. Do you understand? Like this is a plane joint. The joint the facet joint or the zygapophyseal joint is a plane joint, which means it allows movement in almost all directions. But the movement, they have been limited. Some of the movement of the thoracic spine, they have been limited by some other factors, like the spinous process, the anterior longitudinal ligament, and some other factors. Okay, so this is a summary of what I was emphasizing here. Like flexion is limited by the rib cage, but also overlapping spine, but extension very remarkably limited by the spinous process overlapping and the anterior longitudinal ligament. But lateral flexion is there. Rotational is there. Why? Because of the coronal colon orientation of the facet. This is the colon orientation of the facet because one is found anterior and one is posterior, so in between is like the colon orientation. And this is what I was telling you. It forms a facet joint, which is the plane joint, and the plane joint allow movement in one direction, but the other movements, as we've seen, they are limited by some other factors, but the rotation is best seen or best observed. Last, let's talk about the joints. Let's talk about the joints of the vertebral column, of the joints of the thoracic spine. The other time we saw the joints of the vertebral bodies, and we said this is the symphysis, a wide symphysis. But we have seen the joints of the vertebral arches that I was talking about, the facet joint, the zygapophyseal joint, but we have seen how do they behave in the thoracic spine, because they are arranged in a coronal, the facets are arranged in a coronal direction, and so they allow rotational movement significantly. So today we are going to discuss the joints between the ribs and the vertebral bodies, the so-called the costovertebral joint. The costovertebral joint. So we've seen the ribs and the ribs and the spine and the thoracic vertebra. They are making two important contacts, and one is between the heads and the body, but also the transverse processes. So the joints between the heads of the ribs, and the vertebral bodies, they are also known as the costocorporeal. Costocorporeal means rib, corporeal means body. What body? The body of the thoracic vertebra, the body of the thoracic vertebra. But the joint between the costal transverse is a joint between the costal means rib and the transverse process here. So we have the transverse process of the thoracic vertebra and the tubercle part of the rib that you're articulating. We have a surface at the tubercle what you're articulating. So as we have said, each rib is expected to articulate with the two thoracic vertebra posteriorly, but that was not happening to rib number 1, rib number 10, 11 and 12, or they didn't happen to thoracic spine number 1, T1, T10, T11, T12. The reason we have already explained. I've made myself clear today. Now, what about the costal transverse joint? And the costal transverse joint we have seen is a joint between the tubercle of a rib and the transverse costal facet. This is the transverse costal facet. They happen almost on all the vertebrae except the T11 and T12, because we have said the T11 and T12, they do not have the transverse costal facet, and so they do not articulate with the ribs. All of these, they are synovial joint in nature. They are synovial joint, but they are plain synovial joint, mean they are plain. The articular surfaces are plain, and they allow movement in a number of directions, but the movements have been limited by some other factors like ligaments and this ligament. So guys, I hope you've enjoyed this discussion, the discussion of the thoracic vertebra. If you like this discussion, please don't forget to subscribe and hit the bell button to be notified once we release a new video. I'll be releasing new videos on almost every other day, and so be sure, if you have a question, additional comment, don't forget to put your thoughts in the comment section below. But I have a TikTok and Instagram account that I regularly post the questions and some other tips in your exam. So until next time, stay curious and see you.